everyone. I'm Val Emmons, and this is The Relay, the official podcast of the National Transitions of Care Coalition, where we connect the people, policies, and the practice that make care safer for every patient. We recorded this episode from the Washington, D.C. NTOCC Summit, and in this episode, we speak with one of NTOCC's board members, Sam Stolpe, who's also from Johnson & Johnson. And Sam and I talked about what makes this moment in healthcare so exciting, like the growing role of technology, how evidence drives better transitions, and why collaboration between pharma, providers, and policymakers is essential for improving outcomes. The Relay is powered by the National Transitions of Care Coalition, uniting leaders across healthcare to make every patient handoff safer and more effective. And today's episode was made possible through the support of Johnson & Johnson, proud NTOCC supporter and sponsor dedicated to improving outcomes through innovation and collaboration. To learn more about NTOCC's mission and upcoming initiatives, visit NTOCC.org. Now let's get to it. Here's my conversation with Sam Stolpe. Hey everyone, this is Val Emmons on The Relay. We are launching at the NTOCC Summit. With me today, I have Sam Stolpe with one of our sponsors, Johnson & Johnson. And I just have some questions well, first of all, Sam, what do you think about Summit?
Yeah, Sam is awesome. Not only a sponsor, also a board member.
Oh, yes. Sam is a board member for NTOCC. But what do you think it's going well?
Yeah, the Summit's terrific. It's really just been showcasing like how much has changed inside of the thinking around transition of care, especially in the context of all the evolving technological advances that have been supporting healthcare. So it's kind of an exciting time to talk about transition of care inside of that context.
So many different innovative like technology and stuff like that now that when I started this 15 years ago, we didn't know what that was, and now there's just so many different things that could make transitions better, and people need to be learning about them. So I think we're doing that at the summit today. We're doing a lot of that. So I have a couple of questions that I want to touch on with you. From your perspective, how does Johnson & Johnson view its role in improving care transitions across the healthcare ecosystem?
Yeah, one of the amazing things about the national view that J&J gets is that our teams get to see a variety of applications of things. So what works, what doesn't work, what people are trying, and sharing best practices.
You get the world view. You have the glance of what everyone's doing.
Yeah, and this is not to say that our customers aren't good at doing this amongst themselves,
right,
and sharing information amongst each other and publishing great results when they have them. But what we're especially interested in is like an evidence-driven dissemination of best practices that lead to better care transitions. One of the things that we know is just absolutely critical as the first component of that list of sevens that we think about is just the role of medications in good care transitions. And this is when we see like the biggest interruptions in the continuity of care that patients receive is when they just shift to a different spot. So a big thing that J&J can do and does is disseminates the evidence around not only the assets that J&J has, the products that they produce, the medications that are just so central to good patient care, the evidence that suggests that a given therapy might be helpful or beneficial inside of a care transition, or what sort of options might be available to ensure that the patient stays on therapy and makes those transitions smooth.
What are their social determinants of health?
That's it.
That's one that we added to the 7 elements, 2 years ago? That was, I'm sure, made a lot of different impact on some of the people that are looking at that. So we'll just move on a little bit. So can you share how J&J collaborates with providers and healthcare systems to support better outcomes during the post-discharge period, especially what Dr. Ling was talking about with the high-risk patients?
Yeah, so it really just drills down to if you're supporting better outcomes, this is where pharmaceutical companies really focus, is like the sort of outcomes that you do get. So, for example, managing between office visits for patients that are on therapies that are particularly acute for acute conditions or that have a challenging side effect profile. J&J will work with organizations, both to help them stand up operations associated with the use of these therapies, because they can be very complex or
Hmm.
dealing with complex patients. So providing this right sort of education, as well as the operational know-how to be able to support complex therapies, is a very big part of the way that J&J supports their customers. But it doesn't stop there. It's also this evidence, both generation of evidence and
Right.
collaboration with our customers, as well as dissemination of existing evidence so that they know what the body of evidence suggests are appropriate best practices for both the implementation and the management of patients longitudinally. And that could be either just between office visits or when you're transitioning settings of care.
Right. Because that's important. We have that wealth of knowledge, and if it's not shared and disseminated, then what's the point
Yeah,
of
it's just
having
gathering
it, right?
dust and it,
Yeah, nobody learns from it, and patients suffer. All right. So, what are your perspectives about aligning innovations like AI? That's been, a theme lately. AI with the real world needs of patients, not like the ones that are on paper, but their actual needs, like with social determinants of health, for example, and things of that nature. But when they're transitioning, how do we align AI with their real world needs?
Yeah, it's important to parse AI into its applications. We use this generic term AI quite comprehensively, and sometimes I'm not even convinced that we know exactly
What it is? Yeah.
what well what sort of application that we're talking about,
Right.
because there
There's so
can
many different ones.
right. There's AI assistants that are
Hmm.
being used in healthcare now, where large health systems are using them to do proactive outreach in a voice, an interactive voice that a patient can engage with, that allows them to do scheduling and
Right.
triage and all sorts of amazing applications. But that's one use of AI. There's also being able to direct large language models,
Uh,
large learning models, and to mine your own information and extract meaningful and succinct um, opportunities to engage with the patient. So if we're taking disparate health records and data sources, claims, HIE data, state immunization registry data, and pulling all that in and figuring out what the patient's actual needs are, we can leverage AI tools to do that. So
right.
um, there are a variety of applications, and I think we're at such a nascent phase of
It's
figuring out.
so interesting, isn't it? Everything that's going on with all the AI.
Yeah,
Like
it's
there's every
fascinating.
day
So
there's
we're
something new.
we're still figuring out the art of the possible
Hmm.
and grappling with what are really major hindrances in healthcare, which is our own regulations associated with what we can do.
Right.
So now we know what we're getting, increasingly becoming aware of what's possible, but then there's regulation that
Stops.
well, yeah, it's, in some ways it's barriers, but it's also things around patient safety and
Right. Well, that
privacy,
too.
as well as general concerns around AI and making sure that we're addressing the alignment problem, the safety problems that are fairly well recognized inside of the AI space in general, but have really serious implications inside of healthcare in particular.
Right. So do you feel that AI is more like a tool, and there needs to be a human aspect still remaining, not just AI, not dependent on AI? Because so Swat and I were talking about that earlier. Because some people have this idea that AI is just going to be unleashed on its own. I don't think that's how it's going to be. What are your thoughts on that?
Yeah, well, AI is generally regarded as a tool. We haven't got to anything close to a general AI. It's always like a very specific application that AI does well. So, for example, inside of chess or Go, there's AlphaGo, there's AlphaZero, these AI tools that have been developed specific for that thing, and they just crush everything that's out there. And they do it by training themselves within a matter of hours to be the strongest thing that's out there. But that's just one small application.
Mhm.
So getting where we do that in healthcare, where we're finding applications where AI can just crush it, be it with diagnostics
Mhm.
or with managing patients' schedules and helping them have a seamless and smooth patient journey
Right.
as they navigate this very complex healthcare system. All of those are task driven, and in many ways don't present like a large amount of safety concerns. But to the premise of the question, like, are we going to be able to extract humans from this? Not anything close to it in this um, in the sense that you might think. Now, there are some interesting applications of it that I have seen for like cognitive behavioral therapy, where there's
Yes.
AI tools that have been, they haven't gone through a rigorous FDA evaluation as a medical device, but the FDA has called for that. It is interesting that these things are increasingly emerging where there are jobs that are done by clinicians that AI might be able to do better. And diagnostics, again,
Right.
is another interesting example where AI has been able to flag things that very competent radiologists have
Not
right.
well, because we're human. But, AI, the thing that I like to make people aware of is if you have the wrong input, your output's going to be trash. So as long as AI keeps getting the right input, the outcomes will be fantastic. But if everyone doesn't come together and put the right input, like the right needed uh, information,
That's correct. So
because it
the
can
AI
learn
can
badly too. AI can learn
it can only
badly.
be as
Like,
strong as the data that it's
exactly.
trained on.
Yeah.
So yeah, it is of course the garbage in, garbage out, as
Yeah.
we've said at the
You said
conference.
that.
It certainly holds true for the AIs.
Yeah.
It certainly holds true.
But it's definitely an exciting time in the AI because who would have thought? I mean, who would have thought like that it could be so different? Like 10 years ago, I didn't even know what AI was. And now it's like I use it all the time for different things, but I still have a human element to it too. I still make sure that the information's right that comes out of it because we got to make sure that people aren't just using it and then passing it on. They have to make sure that what comes out of it is accurate. And I think that'll protect patients a lot more having that human element to it.
Yeah, totally agree.
So as healthcare industry, as we move towards value-based care, like everyone's excited about the value-based care. I want to get your take on that. So, what do you see the role of pharma being when it comes to supporting those smoother transitions between care settings?
Inside of value-based care specifically.
Yeah.
Yeah, that one also I think reduces to evidence and sharing what things we've learned
Right.
about where risks might lie between transitions of care and how that contributes to total cost of care, especially, which value-based care hinges at this point really strongly on total cost of care containment.
Mm-hmm.
And what I would love to see is an increased utilization of AI within value-based care.
Yeah.
Like the idea would be something along the lines of, can we use a forklift essentially to get us to a better understanding of the outcomes that patients are having and derive that from the patient record and feed that into accountability applications for the provider. What's missing right now from value-based care is that we hold providers accountable for a cost, but we do very poorly at holding them accountable for anything related to outcomes. Now, what we know about providers is that they embrace execution risk. And what I mean by that is the providers want to be held responsible for things within their locus of control, the sorts of structures or processes that they put in place, their staffing models, the quality of the care that they deliver. They embrace that level of accountability. What they're afraid of is prevalence risk, which is that by virtue of who comes in the door, if it's a particularly acute patient, they'll be more expensive. And because they're not held accountable for the outcome of that patient, they might give them really high quality care and do exactly what they're supposed to do for that individual and still be penalized
Right.
just by virtue of the total cost that
Right.
the patient incurs through the course of their therapy. Now, that's scary for a provider. So I'm not convinced that we've got that right or anything close to it as a healthcare system that's increasingly leaning into value-based care. So our real opportunities, I think, lie with leveraging the technology and thinking holistically about what it means to say, I provided high value care. That the ratio that commonly gets used of cost per unit of quality, I think that makes sense. But we need to define the quality part very clearly if we're going to really lean into value-based.
Quality. What is the definition of that pertain to value-based care? I think it's interesting to see how that'll all roll out and as it progresses. I think it's definitely going to be something that I hope it's better for patients. Like I hope it ends up being better than the fee for services that we have now, but we'll see.
Yeah, it really depends. We have seen some instances where value-based care has introduced strictures on the part of providers. And we've heard people say like that they have very deep concerns associated with value-based care when it comes to selecting therapies where they know that the value of the therapy extends beyond the measurement period. So meaning you'll provide a therapy that has high value, but because that value communicates longitudinally and you're only accountable for the short range, even if it's more expensive or less expensive in the long run, but it has an expensive upfront cost, you'll be penalized as a provider.
Wow.
So unfortunately, there's many things about our healthcare system that simply are not prepared to embrace this evolving standard of care. Like when I was in pharmacy school, I couldn't imagine a world where there were CAR T therapies, where there were gene therapies, where
Right?
you could literally harvest T cells genetically. Now they fight their multiple myeloma.
That's just
Like,
crazy.
it's very wild. But healthcare is a headache and medicine is a miracle. So if we're not figuring out how to take these miracles that are emerging, and I'm very proud to work for a company that just embraces innovation and is going after this whole with everything we got. But it's to see the healthcare system still struggle to be able to accommodate some of the therapies that are emerging and come up with ways to meaningfully solve contractual payment as well as challenges associated with innovative medicines. Like it is admittedly there's a lot of work still left to do.
So what have you been working on, anything particular that you want to share with the listeners?
Well, actually, I don't have anything that I want to highlight from my work. A lot of my work's around value-based payments, so I've been talking about it pretty extensively.
Well, I always give everyone an opportunity, just because sometimes I don't ask a question that, it's important, that something that you want to share.
What is it that you wish you would have been asked?
Yeah, exactly. Maybe that's what I should start calling it. Do you have a should have been asked question? No.
No, it's just really wonderful to be at the conference.
Oh yeah, I'm glad you're enjoying it.
Learned a ton. It's lovely to get to interact with people that so many of whom I've only seen on Zoom before.
Right. Well, you and Norris hang out sometimes. Y'all go to the same conferences a lot. So.
Yeah, repeat offenders.
Yeah, repeat. Yeah. I love talking to Norris too. So, but thank you, Sam, so much, and thanks Johnson & Johnson for being our biggest sponsor, and thank you for being on our board and just helping us to do what we do. I mean, we have to make these transitions smoother and safer and prevent readmissions and just to give the patient a break. We shouldn't be seeing them go home and then come back, go home and come back, go home and come back. And like I was talking with Saswat, like you don't really see a transitions of care if it's a good one.
Yeah.
You see a bad one when it's bad because you see all the flaws. But when it's a good transitions, you won't see it. You won't even know what a transitions of care is because it'll be so smooth.
Yeah, it's like a well-run meeting.
Exactly.
Like if it's going well, no one knows. So I would say you guys did a great job.
Oh, thank you, Sam.
So far, it's been without any hiccups.
Well, I'm glad you guys are enjoying it. It seems like everyone is so far. So, well, thank you.
Yeah, thanks, Val.
All right, so that was my conversation with Sam Stolpe, board member and partner of the National Transitions of Care Coalition with Johnson & Johnson, one of our key sponsors. What stood out to me most was the reminder that good transitions are invisible. When communication, technology, and teamwork align, the patient simply heals. They don't bounce back and forth between settings. And that's what the relay is all about, passing the baton the right way every time. If you enjoyed this conversation, subscribe wherever you listen to the podcast and share it with your colleagues. You can also learn more about NTOCC and our upcoming initiatives at ntocc.org. I'm Val Emmons. Thanks for listening. And remember, the smoother the handoff, the better the care.